Okay, today we are here for another clinical conversation. And today we're going to be talking about mental health care for Latinos. And we have Beth Montero here with us. She's an expert in this space. She is an LMSW in Georgia, and she's a bilingual advocate. And she is going to share her expertise with us today on some of the challenges that she sees for Latinos with accessing mental health care, how we can expand our cultural humility for this population. And she does some advocacy work too. So at more of a systematic macro level, what are some things that we can do as providers to advocate for better and more equitable services? So welcome, Beth. It's good to have you.
Thank you.
And I will get through our housekeeping and introductions first. My name is Megan Mitchell. I will just give you a rundown of some of the stuff that I do. Founder of Agents of Change Test Prep. Obviously, we are so excited to be moving into the CE space so we can provide continuous learning for our community. I work in Washington, D.C. I am in private practice working with children and youth. And I was saying right before we hopped on, I primarily work with neurodivergent youth. So ADHD, autism, learning differences, a variety of different things. I'm also working towards my play therapy credential. So I use a lot of expressive arts, play, obviously when working with kids. It's a very fun job. I do a lot of fun stuff, which is really great. I'm also a DSW student at SUNY Buffalo, and I will be graduating, fingers crossed, in May 2025. So around 1 year from now. And in my DSW program, I'm studying technology, social work, and particularly multicultural supervision and ethics. So that actually ties in very nicely to what we're talking about today, how supervisors can supervise in ways that are culturally humble and how they can ensure that diverse voices are heard and really balance out those power differentials when people are engaging in supervision and consultation. So stay tuned for more about that as that progresses. And let's talk a little bit more about Beth's background. She is from Georgia. She went to get her Bachelor's of Arts in International Affairs, and then she went on to get her MSW at Georgia State. She works as a behavioral health therapist at Highland Rivers Behavioral Health, and she was telling me she does mostly individual and group therapy interventions, diagnostic assessments, crisis interventions for individuals diagnosed with mental health and substance use disorders. So we'll get into that a little bit more. And then she also does some advocacy work, which is great. She emphasizes mental health and cross-cultural communication. Very cool. She did a legislative internship under Congressman Adriano how do you pronounce his last name?
Espaillat.
Espaillat, which is really cool. I'll be very curious to know how that shaped some of the work that you do. And she's blending that social work knowledge, her knowledge of the Latino community with her advocacy work. So there's lots to learn from her experiences. Before we jump into our conversation, some of our learning objectives for today. Participants will be able to identify and understand barriers to access. So what are some of the barriers that the Latino population faces in accessing mental health care? What are these barriers? How do we eliminate these barriers, or how do we make it easier to access care? And I'm sure we'll get into this, but quality care, because quality is very important as well. Develop culturally competent intervention strategies. So we will talk about, say you are working with someone that is Latino or identifies as Latino, what can you do to make sure that you're serving them effectively while being culturally humble, being curious, and being respectful of cultural differences? And then lastly, she's going to tell us a little bit about her advocacy work and what we can do at a systematic level, because we know that clients don't exist in a vacuum. We don't exist in a vacuum. There are many different layers to the systems that we work within and work with. And what are some community-based advocacy things that she has been involved with? So we'll get into a lot of different aspects today. And then lastly, why is this topic important? Increasing cultural humility. We know that the United States is becoming more and more diverse. So it is important that our are as therapists, as social workers, as mental health providers, we're meeting the needs of this diverse population. And like I said, quality is really important, making sure they have access to quality mental health care. Addressing health disparities, Latinos often face significant disparities in accessing mental health services. And we'll talk about this language, insurance, cultural stigmas, availability of culturally appropriate and culturally sensitive practices. And then lastly, we'll talk about advocacy skills and at more systematic macro levels, what we can do to get the conversation starting and what are some tangible things that we can do. So, without further ado, I'd like to welcome you. So, go ahead and introduce yourself and tell us a little bit about the work that you do.
So I work in more of rural Georgia. So it's not Atlanta. It's not like Metro Atlanta. So diversity is still, you see diversity, but you don't see services being targeted to Latinos or to any minority.
Mm,
So services here are a little bit different because agencies want to make that change and want to be more aware of minorities and target minorities, but there's still a lot to do. So that's what a little bit of my work focuses around. It focuses around just the mental health, but also I do a lot of advocacy work with the National Alliance on Mental Illnesses, so with NAMI, and then creating services within NAMI that are more targeted towards the Latino population and that are actually in Spanish.
awesome. And just a note, you are bilingual. So we were talking a little bit about that as well. So she has really good expertise in this area. How did you get involved in working with this clientele? And you said it kind of drew you, but tell us a little bit about where your passion for serving the Latino population came from.
So my mom is from El Salvador, and my dad was raised in Venezuela, and his family's from Venezuela. And I was always surrounded by Latinos, and I was always surrounded by Latinos that were very hardworking, but that the system was taking advantage of them in so many different ways. So I started translating at a very early age. I was probably like 7 or 8, and my parents would just send me with my neighbors that needed translation at medical offices or anything that they needed. And I was reading letters at a very early age. And so I just, this population has always completely had my heart. And it's really amazing to now work for an agency that wants to go more into the Latino population and to be able to be a part of that.
That's truly been something that's been a part of your life for a very long time. So it makes sense the progression is now as an adult that you transitioned into this. So I am going to start with our important stat. So Lollybeth shared this with us. More than 1 in 5 Latino adults report having a mental illness, yet compared to the 52.1% of white patients who receive mental health care in 2021, only 36.1 of Hispanics and Latinos received care. Tell me a little bit about this stat. What do you think? I mean, there's a variety of different reasons that this exists, but what do you think? I know we have here cultural stigma, limited English proficiency, high costs, lack of bilingual providers. Tell me a little bit about when you see the statistic, what resonates with you.
Yeah, I think the statistic is very true, especially in the work that I've done, especially like working with clients at the Tahare Justice Center. And these are women that have, they've gone through gender based violence. And I mean, they have a lot of trauma and they want to process that trauma. But unfortunately, there's not really a space for them to process that trauma because doing like case management and trying to get them into a therapist. The wait times are so long. They have to bring like all this paperwork and all these requirements, and they don't really have that. And then sometimes when they go there, they're met with people that don't even speak their language. Um, so you see like all of these barriers, and even before like these systemic barriers, there's a huge barrier of stigma
Mm.
in the Latino community, and just like even going to a mental health professional, you're crazy, and your family labels you as that. So they're coming in with that to begin with, and then just to be met with a wall when they try to get services.
Yeah, and then our next stat we have here, which is not surprising, according to 2021 data from APA, more than 80% of the psychology workforce is made up of white psychologists. It's generally white females is who makes up the mental health profession. And then Latinos, on the other hand, are only 8% of the workforce. So tell me a little bit about that. And there's tons of research. I study this too, that it's very important that outcomes are actually better when clients are paired with someone from the same cultural background as them. So if there's only 8% of Latinos making up the mental health workforce, that's an additional barrier. So tell me a little bit about that. And like you said, wait list, they might not have a provider that they're able to see. So tell me a little bit about how you see this in your work as well.
So, with this question, another thing is when you're looking at just 8% of the psychology workforce, you're looking at that 8% walking into rooms with people that don't look like them
Mm.
and having to advocate for themselves and then for their community. And so, I have in in my professional life, I've really searched for those spaces where I can find other Latino professionals and get that support. And I even reached out to a social worker group in Chicago because I couldn't really find one in Georgia. So I was like, oh, I'll just do Zoom and do it with one in Chicago. So that's another thing that it's a huge weight for the professionals that are working right now. And then, yeah, that 8% and taking care of, you know, Latinos are the biggest minority, like, and they're growing. So that 8% is being, they're being spread pretty thin. So, yes.
I that got me thinking, also oftentimes I have heard that bilingual providers, you can tell me your experience, they sometimes are working twice as hard for the same amount of pay. There's a lot of move that if you are providing translation services or you are going between both languages, that you're doing more work. So there should be more pay, but that's not the case. So it there's a lot of problems also with having this super needed skill set, but not being compensated or getting the support you need as a bilingual provider. So tell me a little bit about if you see that too. That's just what I've heard, but I would be curious to hear your experience as well around that.
Yes, I mean, I definitely see that because I'm also being like pulled in the front, like during an intake with a Spanish speaking client, but then also being pulled when the nurse practitioner is seeing them. And it does give them a better level of care than if you're using a language line. But it's a lot on the professional, and not to mention that you're also looking like, okay, you can go on therapist aid and everything comes up in English, but you're also having to create these worksheets in Spanish and find them in Spanish. So it's a lot.
Um, Also from what I have been studying for my doctoral research is not even talking about the clinician client, like you had mentioned, finding other providers that you can seek consultation for that understand So finding a supervisor that also identifies as Latino can be very difficult because there's not that representation there. So I have heard that it has to, thank goodness for Zoom and more virtual options, but it can be quite isolating, especially if you work in rural Georgia, if you're one of the only Spanish speaking providers in your area.
Yes, I actually was very fortunate that for my first internship for my MSW, I had a bilingual Latina, and it really, really helped me because she honed in on like boundaries, and just how much I couldn't get burned out.
Yeah.
And she really took care of me, and really built me professionally, and I'm very thankful that I had that experience.
Yeah, that's so important to make sure that you have the support that you need. And that's a big push that also I know schools are really trying to do better with pairing supervisors with supervisees. Have you found also in your work that when maybe you're in consultation or supervision talking about a case, if a provider is not familiar with the Latino population, that maybe they're not able to give you the clinical support that you need?
Yeah, because I think that there's a lot of like intricacies into how like Latino families function. Like, for example, how a lot of us, even though we're like grown, we still follow what our parents say. And family is so important.
Mhm.
um, and other people really don't understand that. Like they don't really understand like why would you have your parents move in with you? Why would you take care of them? And so yeah, it is really nice to have like another Latino that understands those things.
Yeah, westernized United States culture is very individualistic, and that can often be clashing or it can be at odds with some other cultural norms and cultural expectations from minority groups. And there's a variety of reasons why US is so individualized, but I think also that can, like you said, there can be some maybe misunderstanding, or I have seen judgment placed on that, right? Where there should not be judgment. This is what is appropriate, and this is common tradition for those in the Latino population. I want to follow up. So we say Latino, right? That is a huge umbrella term. So, what are some specific cultural systematic barriers you've come across? Is there different dialects? I'm sure every country, every culture has different traditions and values. So, what are some things that you have seen in your work?
Yeah, so I worked in Gainesville. I did my internship in Gainesville, which has a really high Guatemalan population. And so we had a lot of Guatemalans that would come in, and this woman came in, and I was speaking to her in Spanish, and I did not understand why she wasn't understanding what I was saying. And it's because she spoke like an indigenous language. And so it is it, you yeah, you run into those things where it's like, oh, they don't speak Spanish.
Right.
And that was really hard. It was really hard for me because it was the first time that I had been met with not knowing another person's language within the Latino community.
I can imagine that creates another barrier. So, yes, you speak Spanish, but there's indigenous dialects and indigenous languages. So, I would assume for those that are within that population, they face even more barriers because they're not going to have access to someone that in the United States that is maybe familiar with their language. And a lot does get lost in there's translation services, but a lot does get lost in translation. I have seen when there's a third party. So I know you can call a language line sometimes, but it's just not the same.
And even like calling like language lines in these indigenous languages, the like the percentage of people that actually know that language and are able to be bilingual in it, is very small. And you saw that a lot with like immigration. they are given Spanish interpreters, and they can't speak to these Spanish interpreters, but they're like, "Oh, but that's your language." So it is very hard to find these people.
Yeah. So I want to touch on, I know you said there are some resources that exist, but oftentimes you might be creating the resources or you have to go hunt out the resources. So that's extra time, right? That's extra effort. What do you see that you've found effective for your Spanish speaking clients when you're trying to give resources or information? Do you have any go-tos or suggestions there?
So I find that it's really helpful if you know, like if you call the agency and you know that someone speaks Spanish within the agency that's able to meet the client when they get there. That's always really helpful because the client is walking in and some of them are very timid and they're walking in very scared. So just having like that friendly face that's going to meet them and giving them a name, and letting that person know.
I would also think making that connection might help the uptake of services, right? If I know
Mhm.
I have a like someone that is there that's going to support me, I'm probably more likely to follow through on actually um utilizing those services. I don't know if you see this. I have worked DC is very diverse, many different diversity is represented, but oftentimes I would have families just say I gave up because it was so hard to manage the system. I'm being called, I don't know what they're saying. They're giving me paperwork in English and they said I really tried, but it just became so tough that there was too many barriers and it does really weigh on you at a certain point. Like it's very frustrating. So I'd be curious if you see that too, that there's just so many barriers that it actually prevents someone from getting the services that they need.
Yeah, and then sometimes they don't even know that those services are available to them.
Yes.
Like I had a client who her son um, was having these mental health symptoms, and I was like, "Why don't you just take him to the doctor?" And she's like, "Well, he doesn't have insurance." And I
Mm.
said, "But he's born here. He was born here, and he does qualify for health insurance." She didn't even know that was available to her son.
Yeah, I worked in schools and I often saw the American school system, the US school system's really complicated, right? And it's not the same as often it is in other countries. I had often seen it in special when someone was getting special education services. Parents didn't know that what was available to them or what to ask for. So I oftentimes what I would do is tell them there are advocates out there that speak Spanish. Let me pair you with them so you can. This is a complicated system for anyone. So just so that they could know this is available to you. I think that's really important to know what services are out there that they can access.
Absolutely.
Um, Next question I wanted to touch on is how can social workers say they're not someone that identifies as Latinx? How can they better support the Latino community? Like you said, there's a big representation of this population. How can they better support them? How can they help them? How can they be culturally humble and curious and sensitive?
So the Latino community is very welcoming, and now like Gainesville has been having this festival, like this Christmas parade, and Hispanic Alliance does like they do a float, but it's very Hispanic, and it's nice, and they also like put on a festival. So just attending these festivals and getting familiar with the culture, like going to our restaurants, going to our stores, going to the places that we frequent, and just having that curiosity, because we do want to share our culture and we do want people to become more familiar with our culture.
And I have seen that you can tell me if this is true. There's sometimes pockets of these communities, right? They find their community, which might be neighbors or in the church. How does community play a part in the clients that you serve and helping them get established with others that they can connect with?
Yeah, so community is essential because and community is essential here because a lot many of us lose our families. Like the majority of my family is in El Salvador. And so we have created our own community here with our friends from other countries. So community is huge for them because they feel isolated, they feel alone, um, and giving them that. So like for one of my clients, she really wanted to find a new church, so helping her find that church where she would gain that community.
And like we said, connection is so important in Hispanic culture, family. And it sounds like when they can find community, that can actually be a huge protective factor for
Yeah,
our clients. We want to tap into those protective factors so that at the end of the day, all humans are wired for connection. So finding those connections and finding social supports. So I know that you said that active listening is a very important skill, I think, for anyone, but you have a story that I think is really a great story. So tell me about how when you were using active listening with a client, how that was able to actually help you build rapport. I think this is such a great story.
so during my internship at Tahare, I didn't like we didn't have like video calls. So we would just call them on the phone and do case management over the phone, because this was like after COVID. And I had a client that she would not answer my calls. She wouldn't really talk to me on the phone. But then one day I called her and I heard like this little like chime in the back, this little noise, and I recognized it. And it was the telenovela, which is actually a Turkish soap opera called Amor Eterno. And my mom would watch that all the time. And I told her, "Are you watching Amor Eterno?" And she just laughs and says, "Yes." And I said, "Well, my mom watches it." And then that was the turning point in our relationship.
Mhm.
She started answering my calls. She had a baby girl, and she called me after the baby was born, to help me get the baby's certificate and other documents. And it really changed everything. So just that active listening, but like going beyond that.
Finding those little entry points is what I like to say. I work
Mhm.
with kiddos and sometimes they'll say, what do you they'll say, do you like Harry Potter? And I love Harry Potter. So I'll say, yes, can you look over there on my wall? And that's a way that we can connect, finding any little things. Do you like Star Wars? Like, oh yes, let me get my baby Yoda, right? And then they feel more comfortable because you have that shared interest. So I'm sure with that client, you were able to find your little entry point, and that was your way in to that
Yeah.
relationship. Going off of that, I know you said that discussing professional boundaries is very important because you're building these connections. You might be the only person that they have as a professional support. So, what are some areas that come up for you that you need to set firm boundaries and maybe explain your boundaries with your clients that you serve?
So when I was at Tahari and I was leaving, all of my clients were like, "Can I have your phone number so I can follow you, and follow your social work journey, and so you can continue helping me?" And just having to say like, "No, that's not appropriate," and just having to remind them of that.
Right. This is a therapeutic relationship, right? As much
Mhm.
as it feels like a friendship, it's not. That can be so hard. As social workers too, I think that we're not immune to it either. We feel strong feelings too when we have to terminate from a client. And I tell people that's okay, right? Like you're going to have strong affinity towards clients. It's just how you process that and how you move forward with that that's important.
But also, like, I had a client that her TV broke. And so she called me and wanted me to translate with the person. And my supervisor was like, "You can't do that. Like, you want to teach them to walk on their own. Like you want to teach them independent skills. And you can't just hold their hand like that. And then I also had a client, you mentioned termination, when I was terminating with her, and I said, she got upset and she said, "Why are you leaving me?" And I said, "Well, you know how you taught your kids how to ride bikes? And at one point you had to let go because they could pedal on their own?" And she said, "Yeah." And I said, "That's what this is." And it really changed her attitude on it.
You're ready to pedal on your own. We're taking the training wheels off.
I know.
Yeah, I have a lot of clients that they're doing great and then they say, "But does this mean I'm never going to see you again?" I said, "I'll always be here if you need me, but this is actually a good thing to celebrate. This isn't a negative. I'm not punishing you. This is great. This means that you're able to do these skills on your own and we're seeing a lot of improvement, but it can be so hard because they do have these personal connections with us and like I said, it's even for us as providers, it's hard to say goodbye sometimes because we've seen so much growth and we want the best for our clients.
Absolutely.
So this brings me to a question about social work education. And I can tell you, I maybe in a couple lectures got some discussion on working with diverse clients, working with clients from diverse backgrounds, but that's about it. So tell me where you think there are some gaps in social work education. And just from when I was doing needs assessment for creating continuing ed, a lot of providers said, there's not information about working with Latino clients. And also some providers were telling me, why aren't CEs offered in Spanish, right? So there's just so many different gaps that exist. But where for you in your bachelor and your master's, did you see that there could be an opportunity for different courses or different topics that could be incorporated into the education piece of it?
Yeah. So in my MSW program, I would specifically like write a lot of my papers on it, and I would do a lot of my presentations
Mhm.
on the Latino community. Like I did one on like the effects of deportation
Yeah.
on Latino children. And a lot of my classmates were like, "What is this? This is the first time I've ever seen this." And that's a reality. Like my professors wouldn't really talk about it.
Yeah,
Um,
I'm trying to even think. I think I had a social policy class and it was probably covered as a 1 week topic, but I'm even thinking there could be certificates or programs that are specifically designed for providers that want to work with diverse youth so that you can specialize in that area. So I would like to see that. I think there's such a huge opportunity for that.
yeah. And I think that CEUs, especially like even in Spanish or even like in both languages,
Right.
would be really cool.
Yeah, that was a big thing that came up, and I'm like, oh, of course that makes sense. That maybe providers don't want to only, just as our clients might feel comfortable with English, that might not be their preferred language, right? I also think that there should be more emphasis on the hiring of bilingual providers. That's such a shortage. When I worked in DC public schools, there was maybe one bilingual evaluator for 15 schools. So getting that provider to come in, I mean, they have hundreds upon thousands of kids that they need to see. There's such a high need for these providers.
Yeah.
Okay. So, I want to ask you, can you share a story from your practice that illustrates a success or learning moment that you had when working with a Latino client that you can think of?
Yeah, so I had one Latino client that came in and she was going back to Colombia. And she said, "Well, you have like 2.5 weeks to work with me
Wow.
before I leave." And that was hard. At the beginning, I was like, "What am I going to do?" Um, but she came in the first day and she had like her hair covering her face and her eyes would not, like, she just, her eyes were just down the entire time. And she kind of like would look at me and she started talking and just very negative about herself. And I worked on like positive affirmations with her, but she created her own positive affirmations. And she told me there's nothing good about me. And then we worked on one, and then she found like 5 or 6 things that were good about herself. And after that third session, and then for one one of the times, I actually went in and translated for her nurse practitioner, so that she could have like proper medications that would work for her, as she was going back to Colombia. And that third session that she came in, she smiled, and she said, "Thank you for everything." And she gave me a hug. And I wish that I would have had more time with her. But I think that in that short amount of time, we did make some progress.
And that's something that as practitioners we need to keep in mind. Sometimes we are time bound, right? We might
Mhm.
only have a class. I heard somewhere that we should assume that the anytime they walk into our office might be the last time that we see them. So making
Mhm.
sure that we are really intentional about the work that we do with our clients is also important as well. Um, I wanted to touch on really quick. You said that you sometimes have to translate for nurse practitioners or more of the medical providers. Is there a stigma around medication in the Latino population, or just not understanding you're prescribed this medication? I could see, I can imagine that might be something too, that what does this mean? What does this medication mean? Do you find that as well?
Yeah, and I think it's more prevalent like in the mental health field because I also translate for a primary care doctor on the weekends. And he has like this mobile health clinic. And I feel like people there, like they give them a medication, they're like, "Oh, I'm going to take it. Thanks." But there's like more questioning within the mental
Yeah.
health field. Do I really need this? Does this mean I'm crazy?
Mm-hmm. I mean, we see that with generally in the field, right? And then to maybe be prescribed it, and that is not something that is standard practice. Or what does this mean? I think do you have to provide a lot of psychoeducation about what the medication might do, or what is the purpose of it, why it could be beneficial to them? I can imagine psychoed is very important piece.
Yes, definitely.
So I know that we talked about kind of the clinical micro level skills, but you do some advocacy work. So I want to switch gears and talk about the macro policy advocacy work that you do. You had a really interesting experience working with someone that has the legislative background. So tell me a little bit about what that was like and how that shaped your advocacy effort.
Yeah, so I did a 3-month internship in DC with CHCI, which is the Congressional Hispanic Caucus
Yep.
Institute. And it was eye opening for me because I participated in 2 marches. One was on immigration, and the other one was after Parkland. So it was March for Our Lives.
Yep.
And getting that opportunity to march in DC was just so amazing because I had never done that in Georgia, and so I brought that back, and I marched in Georgia for to close the Atlanta Detention Center, and then it motivated me during my MSW. It I had to like track a bill. So I tracked HB 1013, which was the largest mental health bill in Georgia that passed. And so that opportunity to like be at the Georgia Capitol and advocate and have people say like some nasty things to you, but know that you're doing it to help others was a really nice opportunity.
I'm a little spoiled because I live in DC and there's a march for something or some sort of advocacy daily. But it is really moving and cool to participate in something like that. Kind of where it all happens here in our nation's capital. And like you said, there's always marches here, but there's always counter protests and there's always some of that negativity that you see. And I often say social work is political. We can say it's not. It absolutely is political. So I think it's so important. A lot of times, right, people are like, I'm a clinical practitioner, but okay. But like I said, clients exist in systems and we exist in a political environment, and there's so many different factors. We can do all the clinical work we can, but if we're not advocating for systems that are going to better affect the lives of our clients, I think that that's a really missed opportunity. So I'm very much in the, you have to really infiltrate at micro, meso, and macro levels to make change.
Absolutely.
Tell me, so you have a lot of experience in this area. What are some specific things that you think, or what were some specific policies or areas you were advocating for Latino youth or Hispanic? I'm sorry, not youth, Latino population or Hispanic population when you were doing your advocacy work?
Yeah, so immigration is huge, and definitely we do need an immigration reform. So that was a huge thing, but also looking at access to education
Mm,
for undocumented youth, and when they go to college, like
yeah,
what's there for them when you take away all of that aid and you really don't let them advance, or you charge them tuition that's like charged for international students,
yeah.
which happens here in Georgia, um, is a lot. You're closing doors for them.
Yeah. I worked in higher ed for a few years here in DC, and I saw that sometimes too with these Hispanic students. They were first generation college students. They did not have the knowledge that they need. I mean, it already is hard enough. I'm a first generation college student too, applying for financial aid, loans. And a lot of them were like, I don't know how I'm going to pay, or I don't have someone that can co-sign on on a loan to be able to take out my tuition money. So it is such a complex system, and then to be not familiar with it or not have supports is huge. Like you said, it closes so many doors.
Or even what people like in education say to them when they're preparing for college. Because I was fortunate that I had a counselor that was amazing and believed in me. But when I got to college, someone said, well, when I was getting ready for college, someone told me, well, you already graduated from high school. That's enough for a Latina. Like that's beyond. You don't need to go to college. So just like that rhetoric, like being used.
Yeah, and that like you did enough. Okay, you've maxed out. You don't need to go further. When we know that higher ed can off there's so many opportunities, higher salaries, opportunities to different jobs. So like you said, closing those doors without even giving them the chance to walk through that door.
Mhm.
And tell me a little bit about, I know you said undocumented Latinos face a lot of challenges. Can they access mental health care? How do you help a client that might, they're not insured, so we know that the health we I will say that the mental health and healthcare insurance is broken. So how do you help them navigate that? It's challenging.
Well, it's also hard because like some places like do have like sliding scales, but then they ask for social security numbers.
That's a
And
huge
these
thing.
people don't have it. Yeah. So you're closing that door right there.
Immediately.
Yeah. So that's hard. And then like even some people that are like in the immigration process, some still don't have social security numbers. So they're trying, but then that door is also closed on them.
Something we didn't touch on, but I think it's important. Is there a fear level of some of the clients that you work with, if they are undocumented, that I don't want to put myself out there in fear that I might be reported and be deported back, or I don't want to, expose myself. I saw that in schools a lot of fear, and just I'm going to keep to myself, keep my head down, because I do fear that, I mean, if you turn on the news, that's all you hear right now is immigration, immigration, immigration. Do you see that as well as that fear of not wanting to put themselves out there?
Yeah, I had a teacher call me once that one of her students He had broken his arm, and his parents didn't take him to the hospital, and it wasn't setting right. And so the kid was in extreme pain, but his parents were like, no, no, like, we're undocumented, we can't take him to the hospital. So yeah, you see that, but then what would that look like for a social worker that doesn't really know what's going on? It would look like negligence.
I was gonna say that would be, what do they teach us in school? Report. That'd be an immediate report versus what supports can we get you? What care is available to your child that we can help you with? Do you have to also do some psychoeducation around things like mandated reporting or that type of stuff for some of your clients? That for some clients I saw was a completely new concept. They're like, what do you mean that you're a mandated reporter and you might need to call this other service, right? Or this other agency. And that can sound so scary.
Yeah, definitely. I don't really deal with a lot of like reporting. Um, but I will say, I think it also comes from a lack of knowledge when it comes to like our healthcare systems, because in like some Latin American countries, you pay for your medical costs up front.
Mm.
And so people don't really know that if they go to the emergency room, they'll be seen and a bill will come, and you can get it reduced and you can make payments. And so they don't really know those things.
Right. It's like they think I can't, pay for that up front. And it's like you can be seen, you will get a large bill in the mail, but they will see you if necessary. If you could give one wrap up piece of advice on the macro advocacy level for providers, what would that be? What is like kind of your big takeaway of what is needed for advocacy efforts to better the better the outcomes and close that gap in disparities for Latino clients?
I think that it definitely goes back to what you said. If like social workers want to see systemic change, like we have to work on that. We have to be involved. Like we have to look at what bills are being
Yeah.
passed and how they're going to affect our clients. And we got to make those calls. I
Yeah.
mean, those calls get tracked. Like it tracks how many people says yes and no for a bill. So we we have to make those calls.
Using our voices, like you said, it seems like, oh, they're not going to listen to what I have to say. They do, right? It's so important. And that's how historically all these movements have happened. You get enough people to speak up and say no or yes, that makes a difference.
Mhm. Yes.
So I guess to wrap up, what would you say is your favorite part about working with the Latino population, or your just what keeps you going day to day? Because you've been doing this work for pretty much since you were a young child, but what keeps you going?
I definitely think the warmth of the community, just the like the a lot of what we do is like through food. Like food
Yeah.
is such a big thing in our community. And so just seeing like the blending of foods and the different languages. Um for example, like one time at church, one of our this woman from Guatemala, she sang in her indigenous language, and just seeing that and seeing like the vibrant colors, the wardrobes, the just the pride in our culture is what keeps me going, and also the work ethic of our people, and how hardworking they are and how resilient they are, but also how joyful my community is.
I love that. Just from my experience working in schools, the hard working is huge. And just what I had seen is how much effort they put into making the experience for their children, allowing them to have opportunities have more than they did. They were so grateful to the education system, so kind and so gracious for any opportunity that their children were getting. I loved to see that too. Like you said, that pride and that work ethic is just amazing. I think that is part of the culture.
Yeah.
Well, to wrap up, I have listed some key resources that people can check out if they are looking for more services, more academic research on how to work with Latino and work with them effectively, and some of the barriers that they have and how we can break down those barriers. But I wanted to just thank you so much, Lalibeth, for coming on and sharing your expertise. This is such an important topic, and it's conversations with providers like you that are really going to help those in the helping profession become more knowledgeable, become more curious, and just more educated. So I thank you for taking the time today.
Thank you so much for having me.
Thank you. I hope you enjoyed the Social Work CE from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or the link in the description to purchase the course and take the post-test. If you're looking for more CEs, check out our unlimited plan. You'll get unlimited access to 150 plus ASWB approved continuing education courses for one low annual fee. We're always adding new courses and bringing on new experts. Did I mention we also have 5 free CEU credits available too? Check it out at agentsofchangetraining.com.